Hello, my name is Mary Jo Lechowicz, and I am a lymphoma specialist at the Winship Cancer Institute at Emory University in the Department of Hematology and Medical Oncology. And I was asked today to talk about how we can bridge the gap of disparities in T-cell lymphomas. I think a number of things that we already know, but worth mentioning is that even over the last 40 years, that there's still significant difference between survival between our cohort of B-cell lymphomas versus our T-cell lymphoma patients. And we see those outcomes that play out in both adult and the child population. And so from there, one thing to think about, as we know, there's some very exciting discoveries of new biology, and we're hoping that these turn into real changes for treatment, but also because T-cell lymphomas, there are quite a number of subtypes and they are much rarer than our B-cell counterparts, that collaboration internationally is key. I think the other thing, but as we all know, disparities exist for a variety of reasons. And knowing that this is an international audience, a number of different types of health care structures obviously occur and vary between country to country. But some of the things that are common to all of us are still social determinants of health. And considering those, I think, is key. As we all try to strive for individualized medicine, I think we often think about it based on the pathophysiology and the characteristics of the cancer cells themselves. And what we really need to do is also expand upon addressing those social determinants of health to advance cancer health equity. And so that includes not only thinking about the biology, as we often do, and the comorbidities and the like, but also people's living environments, their institutional environments in terms of regulations and policies, and then structural things such as marginalization, discrimination, and the like. I think where many systems fall is when there's not a plan. And it may often feel like for an individual patient that we're, quote, reinventing the wheel. One thing we discussed is considering bridging the gaps, and Mohan and Artiga both mentioned this in terms of thinking about social determinants of health in 5 key domains. And we ought to think about this in terms of when we're taking our social histories, in terms of where the neighborhood and their built-in environments and issues with regard to that, economic stability, the level of health literacy, health and healthcare, and again, in terms of their coverage, and then social and community context with regard to their own healthcare, so their own healthcare system, and who their caretakers are, and what the flexibility is by transportation, by employment, and by ableness, that they're able to have the care that they receive. These are just a few things that many are starting to think about. Our colleagues in prostate cancer and breast cancer have been doing some wonderful things, and those can be found on multiple websites in terms of how they've made that change. I think our group needs to, we have some studies going on, some international studies, some multi-centered studies going on to try and look at this in the United States by my colleague, Pam Allen. And I think many people are interested in looking at this more globally. And so again, as always with T-cell lymphomas and very rare and unique diseases, that collaboration and cooperation is key. Thank you so much, and have a wonderful day.